I'm Chris Mortensen. You know, I've seen a lot of starting lineups. This one's impressive.
Anthony Fletcher, Georgetown University.
Fred Metters, Baylor College of Medicine.
Ali Krish, Emory University.
Kathleen Soteric, Duke University.
Lowry Barnes, Harvard.
Carlos Ramon, Tulane University.
Where do I practice?
Where do I practice? St. Vincent.
St. Vincent.
St. Vincent.
Nationally respected physicians here at St. Vincent and on your team.
St. Vincent. Inspired.
Back Dr. Bushra Shah, who is in from St. Vincent, the Longevity Center there. And this has really become a specialty in medicine, just dealing with our seniors, hasn't it?
Absolutely, because their needs are so specific, and I call them like people take their children to pediatricians, and the way you prescribe medications and illnesses are specific to children. It's just like having older children, big babies, because they're also frail. Their medications need to be looked at closely. Right. There are certain medications you can give them, cannot give them, and how their body responds to that. What are the illnesses that are specific, the syndromes that are specific to geriatrics, and then, you know, and our focus at St. Vincent is longevity, really. So we're actually encouraging people to come at not when you're 80 or 70, but when you're younger, even into your 50s and 40s, so, because we see the whole spectrum from people aging from, you know, and what can we do and intervene at age 30, 40, 50, so that you can age better and you can still be independent and you can still live a very full life and not already have acquired those syndromes and those illnesses when we are less able to help you. Right. So
aging better.
Aging better, living better, and being more independent.
Okay, let's get to the phone calls because they have some questions for you. And we're going to start with Betty, who is in Cabot. Hi, Betty.
Yes, this is Betty from Cabot, and I am an elderly person. I'm 70, and I've never been crazy about sweets before, but here in the last 6 months, I've been craving sweets. That's all I want to seem to eat, and I was wondering if that could be a sign I'm diabetic.
Betty, that's a very common phenomena, and my mother-in-law always says that, you know, she's always heard her elders tell her that as you get older, you start craving sweets. So you're not unusual. You are one of the many. And what happens is that with age, your taste buds, they also undergo changes. And things that salty taste or sour taste, which you may have favored before, is you're not tasting that as much, and it just has to do with the change in taste buds. They also atrophy just like everything else changes in the body, and what seems appealing, or the taste that you do sort of still recognize the best, is the sweet taste, and that's why you enjoy it more. But that does not mean that you're going to become a diabetic. What you do need to do, however, if you have concerns, and family history is a strong reason to get tested, you should go to your doctor and have a simple blood work done, and possibly a urine test, and that will help you put your mind at ease whether you have diabetes or not. Some of the signs that are symptoms that are present in diabetics is they feel thirsty a lot, they have a lot of dry mouth, and they need to go urinate several times a day, may feel tired and get frequent infections. So, but certainly craving for sweets is not a sign of diabetes necessarily.
On its own, it's not. Okay, thank you, Betty. Let's get to Lance from Crockett's Bluff. Hi, Lance.
Hello.
Hello, go ahead.
I'm 47 years old, and I've been paralyzed for 25 years. And I was kind of wondering if I was diagnosed with gastroparesis. And I was wondering if that might have something to do with my blood sugar staying higher during the nighttime hours.
Diabetes can cause gastroparesis, and you can, because diabetes affects nerves, even nerves that innervate your internal organs. So if you do have diabetes, if your blood sugar is staying up, then the best thing for you to do is get tighter control or better control of your blood sugars. Take your medication on time, take it regularly, and maybe you need to see your doctor about increasing the dose. But, you know, if that may or may not help improve the symptoms of gastroparesis, which really, for those viewers who are watching, gastroparesis means that the food just takes longer to be emptied from the stomach, and it can give you a feeling of indigestion, heaviness, sometimes nausea, and reflux as well. There are medications, Scott, that you can take that can help improve the gastroparesis. A gastroenterologist is a doctor that you might need to see and have your primary care refer you to them. There are certain procedures now that can be done to help gastroparesis as well. You know, medicine has made a lot of advancements in that area as well. So, you know, but do get better control of your blood sugars.
Yeah, something he should look at. Thanks so much. We're out of time, but we want to put up the information about the Longevity Center because, as you mentioned, it's not just for senior citizens. You guys encourage people to get in there even earlier and be sure that you have longevity.
That's right.
Yeah, they're at St. Vincent, number 2 St. Vincent Circle, and there's the information on your screen on how you can reach them. Dr. Shah, thank you. Thanks for coming in again.
Thank you so much.
Come back soon, all right? Obviously, a lot of questions about symptoms as we age. All right.